I appreciate everybody being here today. My name is Dr. Matt Dasho. I am the interim chair for the Department of Global Health and Emerging Diseases at the UTMB School of Public and Population Health. And so I appreciate everybody being here today, joining us, looks like from all over the world. So, NETEC is a really outstanding organization whose mission is to set the gold standard for special pathogen preparedness and response across health systems in the United States, with the goals of driving best practices, closing knowledge gaps, and developing innovative solutions. As you can see, NETEC is set up all over the United States. And in 2015, recognizing a need across the nation for additional biocontainment unit beds and really laying the groundwork for broader special pathogen network, the Department of Health and Human Services designated 10 regional emerging special pathogen treatment centers, or RESPITs, throughout the country, and then charged NETEC with supporting the advancement of regional preparedness. In just the past year, HHS has designated 3 additional sites, bringing the total number of RESPITs to 13. It's a fascinating group because clinicians, researchers, emergency responders, and other healthcare professionals from the 13 respites bring their knowledge and experience in high consequences infectious diseases to NETEC to meet the needs of healthcare facilities, emergency responders, and researchers from across the country. NETEC has several areas of focus. It helps healthcare facilities and EMS agencies prepare for special pathogen events with free virtual and on-site readiness consulting and program assessments. And these are programs that allow hospitals to gauge their readiness using self-assessment, providing direct feedback to hospitals using on-site assessment, including on-site and remote guidance, and then emergency call mobilization. They also offer courses and training for nurses, physicians, emergency responders, other healthcare professionals that equip them with preparedness best practices. And you can see all of the different types of training programs, including both didactic, hands-on simulation training in person. They offer self-paced educational programs through online resources. There's also an online repository of tools, and then customizable research templates. We're also, NETEC also supports the Special Pathogens Research Network, which has created an infrastructure to improve readiness for conducting rapid clinical research related to special pathogens in the United States, and provides researchers with training, tools, and the resources to quickly understand clinical syndromes, as well as studying effective treatments and clinical management strategies. NETEC's international partnerships and programs convene representatives from around the globe to share best practices and experiences with special pathogen outbreaks, with the goal of establishing strategic international collaborations that advance United States and global special pathogens preparedness. So really from the United States to the world. So as you can see, the webinar is going to be organized over about the next 45 minutes to an hour. I'm giving the welcome. And then we're going to hear from Dr. Ben Beard on the impact of climate change on vector-borne disease in the United States. Then our colleague here from UTMB, Dr. Dennis Bente, will present on the climate impact of tick-borne viruses. And then Dr. Tara Benesh will present on translating climate science into patient care. We will then have time for some Q&A. And if you look in your Zoom, you'll see there's a Q&A button. You can put questions there anytime. And then I will finish up by talking about some of the NETEC resources. All right. So without further ado, we are going to go on to our first speaker. Our first speaker is Dr. Ben Beard, and I'm just going to pull up Dr. Beard's bio real quickly. Dr. Beard, who I've just had the privilege to meet, is the Deputy Director of the CDC's Division of Vector-Borne Diseases. He is also the co-chair of CDC's Climate and Health Task Force, and for the last 6 years was CDC's representative to the United States Department of Health and Human Services Tick-Borne Disease Working Group. Dr. Beard is going to talk to us about the impact of climate change on vector-borne diseases in the United States. Dr. Beard, I hand it over to you.
Thanks, Matt. It's good to be here today, and it's my pleasure and honor to take part in the webinar. So next slide. So in terms of climate change, for all intents and purposes, what we see here in the U.S. that is relevant to emerging infectious diseases and vector-borne diseases in particular, are we're seeing longer and warmer summers. We're seeing shorter and milder winters, increased frequency of severe and unpredictable weather events. So this includes storms, heat waves, droughts, a lot of regional variation, as you can see in this image here, in terms of the reduction in the numbers of days of frost that we have, for example. And then finally, there's an influence on global weather patterns. So these are things like El Nino and La Nina, patterns that can actually, they're weather patterns, and they can actually have a pretty significant impact on disease emergence. I enjoy looking at this, or find it very meaningful to look at emerging infectious diseases and climate change through One Health lens. And so, as we're talking about the convergence and interaction between human health, animal health, and the environment. But what that means is that climate strongly influences the distribution and occurrence of environmentally sensitive diseases. And so as the climate changes, this leads to changes in the environment, which results in changes in disease, ecology, incidence, and distribution. When we're talking about environmentally sensitive infectious diseases, just to make sure we're all on the same page here, we're really talking about 5 general groups of diseases. So these are waterborne diseases, foodborne diseases, soil and dust-associated diseases, zoonoses, zoonotic diseases. So these are diseases that are spread from animals to animals, and then vector-borne. Actually, vector-borne diseases are transmitted to humans through the bites of carriers or vectors. So these include mosquitoes, ticks, and fleas. And here in the U.S., most of the vector-borne diseases that we deal with are also zoonotic, meaning that they're harbored in wild animals and transmitted to people through the bites of ticks or mosquitoes or fleas. Next slide. It was a busy year for us in vector-borne diseases. These are headlines, many of which you may have actually seen. We had outbreaks of local outbreaks of malaria and dengue, local outbreaks of dengue, which are still going on right now in Florida in particular, and recently in California. And so it really kind of begs the question, what have been the trends over the last couple of decades? And so between 2003 and 2023, so in the last 20 years, there have actually been more than 1 million cases of vector-borne diseases that have been reported here in the U.S. And this number of annual reported cases approximately doubled over the last 20 years. And the reported cases substantially underestimates the actual disease occurrence. So what I mean by that, when we talk about disease reporting, that means if you're a healthcare provider and you diagnose a case of Lyme disease, then you're supposed to report that to the city or county health department, and then they report that ultimately to us at CDC. And so there are some 16 to 18 reportable diseases. But with Lyme disease, for example, we see about 30 or 40,000 cases reported every year, and actually the actual estimated number of cases, however, based on insurance database analyses, is much closer to 475,000, almost 500,000 new cases that are diagnosed and treated each year in the U.S. that are not reported by and large. Tick-borne diseases now account for about 80% of all reported vector-borne disease cases, and we're seeing local outbreaks of imported vector-borne diseases more frequently. When the most common mosquito-borne disease in the United States is West Nile virus. And just to look at the trends that we see here, about every decade we have a really big year. And you can see, and a lot of this is related primarily to infection rates in bird populations, because birds are the primary reservoir for West Nile virus infection to people. So actually in 2021, got ahead of myself. want to say a little bit about where we're seeing most of these cases. So West Nile virus, these are neuroinvasive disease cases. Those are the cases that are most serious, and they're the ones that are most likely to end up in the healthcare system, most likely to be diagnosed, so therefore most likely to be reported. And neuroinvasive disease cases account for really about only 1 in 100 or 1 in 150 of all the people who are infected with West Nile virus. The vast majority of cases are milder, 80% are milder, maybe 20% of these cases have summertime flu, and 1 out of 100 or 150 develop the serious neuroinvasive disease. So it's a good marker for where we see most of West Nile virus activities. You can see it really focuses around the central belt of the United States. In the summer of 2021, and this was largely eclipsed due to the COVID epidemic that was going on at the time. But we actually saw the largest local outbreak of West Nile virus that has ever occurred here in the United States, probably even globally. But West Nile virus was introduced into the U.S. in 1999, so it's certainly the largest local outbreak we've had. And there were 2,911 total cases that were reported nationwide, 227 deaths, and almost 60% of these cases occurred in Arizona, with the bulk of these in Maricopa County and Phoenix in particular. And it's impossible to say whether this was linked to climate change. But what we do know is it was a wetter than average monsoonal season that occurred, and this likely interacted with some of these other effects or factors like infection rates in birds, to cause this outbreak in humans. I want to talk a little bit about tick-borne diseases and Lyme disease in particular. This chart really shows what we've seen over the last 20 years in terms of reported Lyme disease cases in the U.S. And in fact, we also see here Babesia cases, Ehrlichia cases, anaplasmosis, and rickettsiosis. And so all of these reportable tick-borne diseases have been increasing over the last 20 years. And the numbers have gotten flat really in the last 2 to 3 years because case reporting has just become very labor intensive. And I'll talk a little bit about that more in a minute. Just to call attention to another very important tick-borne disease that can be very serious and pretty highly fatal if not recognized early and treated, Rocky Mountain spotted fever. We've also seen a huge increase in the reported cases of Rocky Mountain spotted fever over the last 20 years. And then finally, to call attention to what is fortunately a less common tick-borne disease, but one that is emerging and very much a concern to us, Poisson virus encephalitis, or Poisson virus disease. And with Poisson virus, it's also emerging here in the U.S. It's transmitted by the same tick that carries Lyme disease, babesiosis, anaplasmosis, and the black-legged tick, Ixodes scapularis. But we've seen an increase in these Poisson virus cases as well here in the U.S. We've, coincident with the increase in numbers of cases, we've seen a geographic expansion on where these cases are being reported. So if you look at 2001, you're looking really at a dot on the map of the county where Lyme disease case was reported across these states. And if you compare 2001 to 2019, you can see that that the geographic distribution has also increased pretty substantially together with the numbers of cases. And you can also see that we're using shading in a number of states. And if you look particularly at Massachusetts, you'll see that it's shaded, but there's very few cases reported. That's just really demonstrating the problems with reporting with Lyme disease and the fact that it's very burdensome because of the requirement for having epidemiologic case data as well. Good news on that is the case definition was changed in 2022. in 2021. And so in 2022, we'll have, we'll see a lot more Lyme disease cases, for better or for worse, about twice as what we have seen in previous years. But it should be less burdensome and a lot more consistent from year to year and from state to state. This shows surveillance data on the tick, the primary vector of these diseases, Lyme disease in particular, Ixodes scapularis. And so if you just look at the red area on the map, it shows the area of the counties now where this tick has become established. So we've had a huge expansion in its range over the last 20, 25 years as well. And then finally, not only are we seeing more tick-borne disease cases we're reported, an increased geographic distribution of where we're seeing those, but we're also seeing a number of new tick-borne diseases newly recognized. Now, this is not strictly epidemiologic observation, I could say, but it also, actually, what I should say, it also reflects that we have better diagnostic and detection methods, advanced molecular detection methods, whole genome sequencing, metagenomics, which are allowing us to recognize pathogens that have been here, but we've not been able to distinguish them previously. So now we've got better tools. But we also are seeing, it probably also reflects the fact that more people over a broader area are being exposed to the bites of potentially infected ticks. So in many ways, this is also showing kind of this rapid expansion and exposure to ticks and tick-borne diseases. So I want to talk a little bit about weather and about climate change. And this is a complicated slide, but it's not as complicated as it looks. We're really looking at the Northeast region of the US, where we've seen the most expansion of tick-borne diseases. And so it's the same map in each of these panels. And it's divided between the Western region, the Central region, and the Eastern region. And the dots on the map that you're looking at, red or blue, are weather stations. So this is looking at 100 years of weather data from this region of the US. So if you look at the panel on the left, the first panel, we're looking at snow cover. And so you can see snow cover in all three of those regions has pretty significantly decreased over the last 100 years. We've also seen an increase in bare ground, which goes without saying. If you're looking at reduction in snow cover, you're looking at more bare ground days. If you look at frost days, those have also decreased significantly. And if you look at ice days, by and large, those have decreased as well. And then finally, the numbers of extreme cold days have generally decreased. So what makes it complicated, though, is at the same time, we're seeing those weather patterns. You could look at those weather patterns and say, wow, we've seen a very significant changing climate that's clearly having an impact on tick-borne disease emergence. Well, it's more complicated than that, just simply because if you look, for example, at forestation across the U.S., if you look at it in 1800, that blue area in the eastern half of the U.S. really indicates significant forestation. But if you look at 1900, you can see the impacts of deforestation and through expansion of agriculture and lands being cleared and farmed. And then if you look at this change into 2020, we see reforestation that's occurred. So at the same time we've had those temperature changes, we've had some pretty significant changes in the same regions in reforestation. So this is looking at a similar indicator. It's looking at land cover, again, left panel, 1800, very, very green, 1900, a lot more cropland and pasture land that you're seeing. And then in 2020, we've seen a lot more sort of reversion back to forested areas. But you also see the red dots on the map that really indicate growth of suburban and urban areas, large population centers. So, at the same time we're having reforestation, we've had huge amount of suburban sprawl and lots of ecological changes that are occurring in the same area. And finally, to say a little bit about deer densities, because this has played into this picture very significantly as well. And with deer densities, we're really just looking at increase in yellow and purple on the map. And much of this area is in the same area where we're seeing expansion of ticks, because a lot of these ticks have deer as the primary host for the adult stage of the tick. So trying to pull all this together in terms of what's really driving this emergence of tick-borne diseases. We're seeing reforestation, abundant deer populations, expansion of suburbia into these wooded areas, and a lot of ecological changes, things that we call habitat fragmentation, which are ways that suburban corridors are being cut up and sliced that really optimize exposure of people into areas where we can have this whole life cycle for tick-borne diseases with small rodents and deer. Leading to abundant habitat around homes for these Lyme disease reservoir species, and increased exposure opportunities to people for people to the bites of potentially infected ticks. And then with all of that going on, the climate is changing at the same time, which actually has an impact on both in the distribution of animals, their reproduction rates, the numbers of ticks that we're seeing, seasonality of ticks. So it's a very complicated picture. And the key challenge here is in determining how much of the observed changes that we're seeing can be attributed to climate change versus all these other factors that are going on at the same time. So to summarize all of this, and what we've seen and what we expect moving forward, Americans are being exposed increasingly to the risk of vector-borne diseases. These current trends that we're seeing will likely persist and likely even worsen in the absence of effective prevention tools and implementation capacity. And of note, we don't have vaccines currently for any of the vector-borne diseases that we're seeing in the continental U.S., not for Lyme disease, not for West Nile virus. We do have a Lyme disease vaccine that's in clinical trials right now. Hopefully it will be out in the next few years. There's a dengue vaccine. We see dengue in the territories, but not a whole lot of it in the U.S. But we're also seeing these factors that are driving vector-borne disease emergence. These are complex, and they include the influence of multiple environmental factors. And so it remains uncertain how much of vector-borne disease trends could be attributed to climate change versus these other factors that I talked about. And I already mentioned vaccines. So really, primary prevention relies on actions aimed at reducing exposure to the bites of ticks and mosquitoes. So I'd like to kind of wrap my talk up with some attention given to some of these prevention tools and resources that we have at our website at CDC. We've got some really great information on how to prevent ticks and tick bites on people, on pets, and on your property. And so I encourage you to go to this website to look at these. And for ticks, we always say, wear repellents, do tick checks. If you're out in areas where ticks are common, throw your clothes in the dryer on high heat for 10 minutes. That will kill the ticks that are on them. Take a shower. That will wash away any ticks that are not embedded. So you can do these things, do inspections. And if you get a fever or rash during the summer, be sure to tell your healthcare provider promptly tell you guys about this so you can coach. You are the healthcare providers primarily, but this is what we're telling the public. And there's other information at these websites on pets and property. I won't go into that now, but you can look at it. Next slide. We also have a really great resources here on preventing the bites of ticks and mosquitoes. We call it the Fight the Bite page. And so I encourage you to go there. And then finally, these are some clinical resources that we have on diagnosis, treatment, training modules. A really important disease I don't have time to talk about right now, but it is linked to exposure to tick bites, alpha-gal syndrome that we're seeing. And these other pages, one at the bottom really is our tick-borne pathogen surveillance map. So this is surveillance of pathogens in collected ticks. So it's kind of an advanced indicator of where we're seeing these diseases expand before we're actually seeing cases in people. So last slide, I think. In conclusions, environmental change is altering the distribution of the diseases and vectors in reservoirs. More people are being exposed to the bites of potentially infected ticks and mosquitoes throughout longer periods of the year over larger areas. And the public needs to be aware of how these patterns are changing the risk, where they live and where they travel as well. And healthcare providers and public health workforce also need to be aware and knowledgeable of diagnosis, treatment, and prevention, and how these changing circumstances and trends are occurring. So I'll stop with that and pass it on to the next speaker.
Great. Thank you so much, Dr. Beard. That was really, really good. I'm pleased to hand it over to Dr. Dennis Benta, who is a professor in the Department of Microbiology and Immunology at the University of Texas Medical Branch. He is a globally trained virologist, research scientist, and educator who's working to understand better the effects of tick-borne viruses on human and animal health. So a really great person to follow you up, Dr. Beard. And Dennis, I'm going to go ahead and hand off to you.
Thanks, Matt. I want to thank the organizers for having me. I'm excited to be part of this. What I want to focus in my section is to focus on ticks and specifically the viruses that they transmit. And just one essential point up front, the life and the transmission cycle of tick-borne viruses and ticks is quite complex from an ecological perspective and depends on tight connections between the virus, the tick, and the host dynamics. And that makes the giving predictions on how climate change influences their spread very, very challenging. But we've seen a global trend of increasing numbers of tick-borne cases worldwide, and especially we've seen the detection in new areas. And you can imagine this really is crucial that we investigate the connections and why we're seeing the increase in tick-borne viruses. Next slide. So we've heard from Dr. Beard about Powassan virus in the US as one of the tick-borne viruses, and I will not focus very much on this today, but I will rather focus on the viruses that play globally a role. Here you can see an overview of the medically most important tick-borne viruses, mainly the tick-borne hemorrhagic fever viruses. They often have very mysterious names that are often based on where they were located. So you see here, for example, Al-Qumra hemorrhagic fever from Saudi Arabia, or Kaisano forest in India, Omsk hemorrhagic fever virus here found in Siberia and in Russia. And they've been not on many people's radars for the longest time. But in the last 20 or 30 years, we've seen more and more cases in different areas popping up and seeing an increase of cases. And so that's really increased the interest in the tick-borne hemorrhagic fever viruses. The hemorrhagic or the tick-borne hemorrhagic fever viruses, they have to be handled here in the US and many other places in the world at maximum biocontainment, so BSL-4. And this is due to the high case fatality. They cause a really severe disease. And as mentioned by Dr. Beard earlier, there's basically no therapeutic treatment or vaccines for almost all of them, except for tick-borne encephalitis. These viruses have been classified purely based on the human patient's clinical presentations, rather based on viral taxonomy or geographic distribution or the transmission dynamics. And they're really found in diverse parts all around the world and are transmitted by a range of different viruses. So the excellent news for us here in the US is that they are not found in North and South America, with the exception of Powassan virus. The bad news is that we've seen really a significant increase in human cases over the past 2 decades, and we've seen an expansion of the tick vectors. And so there could be the opportunity that some of those vectors will also be imported into the Americas. I think a good global example of a tick-borne hemorrhagic fever virus or a tick-borne virus is Crimean Congo hemorrhagic fever virus. You can see the distribution here of the virus and the ticks that transmit the virus here in this WHO map from 2022. Crimean Congo hemorrhagic fever virus is the second most widespread hemorrhagic fever after dengue virus, and it's the most widespread tick-borne virus of medical importance. But I have to admit that when you look at the map here, the map is a little bit misleading. I think it gives you the impression that there are a lot of cases all around the world, thousands and thousands of cases, but that's actually not the case. Typically, the tick-borne viruses, they cause sporadic diseases. We're talking here in the dozens per country or something like that, just a handful here and there per year, and typically very rural areas. But lately, in the last 20 years, we've seen a tremendous increase of cases here and ongoing endemics with high case numbers in many places. And you can see there here on the map in the red areas, the hotspots for Crimean Congo. So from Turkey ranging all the way to Iraq and Iran and to Afghanistan, all the way into India. And we're not clear what the drivers are between these high case numbers here. There's a drought currently in Iraq that has caused some of the cases. And in Turkey, we've seen now an ongoing endemic over the last 20 or so years of 1,000 cases per year, and we still don't know what is driving the high endemicity of the virus in those countries. The biggest concern with Crimean Congo hemorrhagic fever virus is really the northward expansion of the hyaloma tick that is the main tick vector for the transmission. So typically what you see here is you see the line here of the 50th north latitude. That's typically the line where we don't find any hyaloma ticks. Hyaloma ticks are thermophile ticks. They like warm weather, and they are typically not found beyond the 50th latitude. But things have changed over the last 20 years. We're now finding hyaloma ticks on migratory birds in the UK, in Sweden, in Germany, and other places. So we're clearly seeing an expansion, or we see that the ticks are brought into new areas beyond the 50th latitude. And there's now also evidence that they have established themselves and are not only being brought in, but also have established themselves. And if I would have shown the map to you 10 years ago, you would have seen that Spain and France, which are yellow here now, were gray at that time. In 2016, we had the first 4 cases of Crimean Congo in Spain. And earlier this month, we had the first detection of Crimean Congo in ticks in southern France. So this is really an ongoing and expanding problem, and we just don't understand really why we're seeing this now and what component climate really has in the expansion. So I want to give you just 3 different categories how climate change might influence tick-borne viruses. I think the first one that comes to mind very quickly is the emergence of ticks and tick-borne viruses in new areas. I think we always imagine this, something pops up somewhere new. I think an example that we've dealt with here in the US is the emergence of the Asian longhorn ticks, Haemaphysalis longicornis, that was first detected here in 2017 in the United States, probably imported through animal trade and animal import. Although I want to make it clear at this point, there's no evidence that climate change obviously had an influence on the import and the establishment of the tick in the United States. You could, or it's conceivable that warming temperatures will make it more feasible for non-native ticks from warmer regions. Haemaphysalis longicornis typically comes from the Southeast Asia, to find footholds here in the United States. That's just something to consider. The second point is we see an increase of human case numbers, and this is mostly driven by higher tick numbers. So a greater tick density and a greater tick density of infected ticks will lead to a greater exposure of humans, and that's why we see an increase in case numbers. So I think that's fairly self-explanatory. And then lastly, we could also imagine that climate change might lead to an evolution or adaptation of the tick or the pathogen. So ticks throughout their evolution have already adapted to a lot of different climatic systems. So it's very conceivable that they can adapt to different temperatures quickly. probably not as rapidly as some of the mosquitoes do. We have good evidence for malaria and Anopheles mosquitoes and how quickly they can adapt to urban settings and to changing climate conditions. We know that ticks can do that, probably not as rapidly. And then lastly here, to finish off the slide, I want to also point out the newly emerging viruses in the United States and globally and in general. So just to name a few, we had Bourbon virus here, or Heartland virus, or Lone Star virus, a bunch of other viruses that have been newly discovered around the world. Again, we don't know if this is based on maybe an increased diagnostics or shifting ecology or something like that, or if climate change helped aid the emergence of the virus. But it's definitely conceivable that the changing climate settings will lead to an increase of these newly discovered virus diseases. So as mentioned earlier, there's a great uncertainty of how climate change will influence the transmission cycle, because they are so complex from an ecological perspective. And I listed here, I just give you a mechanistic overview here of some of the factors that will change and that have an influence on ticks. So temperature, rainfall, relative humidity, those are the abiotic factors that you can imagine will change with changing climate. But it's just not a very simple equation. So when you see temperature here, ticks typically rely on the microclimate of the habitats that they live in, and not so much on the macroclimate that they live in. So it's not so much the average temperature in a certain area, but much more like how the microclimate, the leaf litter and so on, or the brushes, the soil and so on change. And then obviously you can imagine that rainfall and relative humidity is an important, but we don't even know how the rainfall patterns will change with changing climate. So a good example, for example, is East Africa here. With all of the different models, we have conflicting results if the rain in Eastern Africa will actually increase or it will decrease. So you can imagine that has really a tremendous influence here as well. And then also, we can also imagine that the temperature will not only influence the tick density and the human exposure, but an increasing temperature will also aid the virus in its replication. So higher temperature lead typically to a higher replication. So we might see a faster transmission of the virus and the spread of the virus in the ticks. And then we also don't know how the increasing temperatures will influence the animal host. You can imagine that animals might migrate or move to different areas, or that increasing temperatures will lead to stress in the animal host, and this will give a better environment for the viruses to replicate or for the ticks to feed on. So to briefly illustrate to you how these parameters are connected in real life, I want to show you the transmission cycle here of Crimean Congo, but which is also you can also use for many other tick-borne viruses here. And I want to use this to illustrate to you how difficult it is to predict what will happen in the future and how this will change. And it will also show you that probably human factors, anthropogenic factors such as land change or land use, land fragmentation, things like that, probably have a much bigger influence on tick-borne viruses than climate change. So what you see here is the fictive 4-year seasonal cycle of a tick-borne virus, the ticks and the animal hosts. So in green, you see here the animal host numbers available for the tick throughout the year. The tick density depends on the animal hosts. And then in orange, you see the tick density throughout the year. And the tick density will lead to human exposure, and that depends the human cases. So the more ticks, the more human exposure, and the more human disease you see. So if there's a disruption in this balance, mostly due to human factors, you will see that these dynamics will change. And one of the things that we're expecting, most likely driven by climate change, is that the seasonality of ticks, or sometimes called phenology of ticks, throughout the year will expand. So these seasons will be longer. The ticks will be active over a longer period of time, and probably we'll also see an increase of higher tick numbers throughout the year. And you can imagine the greater the tick numbers, and the longer the season, the more ticks are active, the more human cases you will see. So my take-home message for everybody is climate change will lead to an emergence of ticks, but also their viruses in new geographic areas, particularly northwards, but not only in the US, but globally. However, ticks and tick-borne viruses will also disappear from other areas. I don't think that's something we've really touched on here at all. So they will specifically disappear from the southern areas of countries. For clinicians, and public health officials, I have two recommendations. First of all, include the previously exotic diseases in your differential diagnosis, and keep in mind that even the virulent tick-borne hemorrhagic fever viruses even have a mild presentation, and especially in the beginning present as a fairly mild flu-like illness with no pathognomonic signs. And then always consider the travel history, even from countries that you typically don't have on your list. I mentioned Spain and southern France here, for example. Then always ask for the occupation or the origin of your patient. So keep in mind that tick-borne diseases typically are transmitted in rural areas, so through farmers or hikers or people that live in rural areas. And at this point, I'm going to hand it off, and I want to thank you for your attention.
Thank you, Dr. Benta. That was really great. I appreciate it. What an interesting kind of flow from hearing from Dr. Beard to hearing your perspective working with these viruses. We're going to go to our last panelist. And again, if you have questions or comments, please put them in the Q&A, and we'll try to get to a couple by the end. We're going to hear now from Dr. Tara Benish. She is an emergency physician that works in Oakland, California. She graduated from UCSF UC Berkeley Joint Medical Program, where she also obtained a Master's of Science studying food systems and health in urban underserved communities. She is currently serving as one of 6 climate and health fellows at the University of Colorado, where she works with Centers for Disease Control on physician education and public health department preparedness for climate-related events. So bringing it to our sweet spot of clinical medicine. Tara, I'm going to hand it off to you.
Thank you so much. Hi, everybody. It's really wonderful to be here. Today I'm here to translate the climate science and the epidemiologic data that we just heard into practical steps that clinicians can take to identify and appropriately treat patients who are affected by vector-borne disease in the setting of a changing climate. So we can go to the next slide. The big questions that we're going to be answering today. Number one is, what vector-borne diseases should I be aware of in my region? I do want to say a caveat that this is focused primarily on the US, but a lot of the takeaway lessons from this presentation can be applied in other areas and just kind of extrapolated to your region. Number two is, how can I keep track of trends in vector-borne disease? 3, how would I diagnose and treat these diseases? And 4, what do I tell my patients? How do I educate them in terms of emerging diseases in light of a changing climate? We're going to be looking at these through a series of cases. So which diseases should you be aware of? Let's start with this case. This is a 22-year-old male who's presenting to a clinic near Chicago. Imagine you're working there as a family medicine practitioner. This patient presents with joint pain, headaches, and this rash for the past 7 days. What's your diagnosis and treatment plan? Can think about it for a second. I unfortunately won't be pausing for questions because there's a lot of you here, but we'll go ahead and show the answer. This is a case of Lyme disease. So although previously not common near Chicago, the spread of the Ixodes tick, which is related to temperatures and temperature changes, tree cover changes, urbanization, and deer migration, has made Lyme disease much more prevalent prevalent in the area. So regardless of where you're working, if you have a patient with bilateral Bell's palsy, this type of rash, or a third-degree heart block after a known tick exposure, definitely consider treating for Lyme disease. This is usually with doxycycline, but if you get to the point of third-degree heart block, this would be with IV ceftriaxone. You can see the distribution here compared from 1996 to 2018, showing the spread of Lyme disease into previously non-endemic regions. We can continue. So the first takeaway that I want you guys to think about is know the vector-borne diseases near you, but also consider new and unfamiliar pathogens. However, how do you keep track of this evolving situation? Next slide. These are some sources of information similar to what Dr. Beard recommended. The Centers for Disease Control is a great resource and does have real-time tracking and mapping tools for ticks, as well as the tick surveillance program and the tick bite data tracker. You can talk to your local public health department to see what diseases have been reported. And we can also look at information from agriculture. So the USDA, as well as the Food and Agriculture Organization of the United States, track vector-borne diseases affecting animals, as well as diseases associated with crops and food supply. And for our global colleagues, the WHO has excellent resources as well. Our next case is a 4-year-old who was recently camping with their family, now developing high fever and a rash that's spreading from their palms and soles to their torso. What medication would you consider giving them? This is a case of Rocky Mountain spotted fever. So all cases of Rocky Mountain spotted fever, regardless of the patient's age or pregnancy status, should be treated with doxycycline emergently. As Dr. Beard mentioned, this disease carries a high mortality rate if untreated. So the takeaway message from this is do not delay life-saving treatments, even if pathogens are not typically found in your area. If you see someone and you suspect Rocky Mountain spotted fever, regardless if there hasn't been a case in your area, you should be giving them doxycycline. All right, here's our third case. This is a 75-year-old male from Maricopa County, Arizona, who presents with high fever, headache, neck stiffness, and severe weakness. He lives alone, was previously independent, with only a history of diabetes and hypertension. You do a full workup, chest x-ray, blood culture, CT head, labs, thyroid testing, nothing is coming out. So you do an LP, which shows lymphocytic pleocytosis and an elevated protein. What more would you contribute to their workup? So you should be doing some diagnostic testing for West Nile virus. This is a case of meningitis or encephalitis related to West Nile virus, which is pretty uncommon, only affecting about 1 in 150 patients, but is more common in patients with comorbidities and carries a mortality rate of 10%. So why are we seeing more West Nile virus in the US? This is related to heat waves, which you could also see in the unprecedented number of cases in Europe and Eurasia in 2010 associated with an extreme summer heat wave. Milder year-round temperatures mean that some mosquitoes can overwinter or emerge earlier in the spring. And so this also can increase the incidence of West Nile virus. And the virus itself actually replicates faster in warmer temperatures. So what testing can you send? To test for West Nile, you should send West Nile virus specific antibodies that are found in blood or CSF. These are IgM antibodies. They're usually detectable 3 to 8 days after the onset of illness and last up to 3 months. You can find any testing information on the CDC website under the healthcare providers page for this information. So this case illustrates that you should consider vector-borne pathogens if the diagnosis is unclear. If it's not fitting a traditional meningitis picture, you're not seeing evidence of a bacterial or viral cause, bacterial cause, think about viral causes, including pathogen or vector-borne diseases. All right, here's another case. This is a 31-year-old female with headache, fever, and joint pain last week, now presenting with melena, dyspnea, and anorexia. You notice this rash on your exam. She had no travel outside the country. Her most recent trip was to Miami, Florida for a wedding 2 weeks ago. What do you think this is? So let's go ahead and show the answer. This is a case of dengue. Dengue fever has made a resurgence due to declining vector control programs, increasing global trade and travel, and expansion of the Aedes aegypti and albopictus mosquitoes due to climate change. 1 in 20 patients develop severe dengue, which can progress to shock and hemorrhage, as in this case. Luckily, supportive therapy can reduce the risk of death from severe dengue to less than 0.5%, but this severe dengue is of higher risk in those who have been previously infected. So how do you diagnose dengue? In the US, this is a nationally notifiable disease, so you should report suspected cases to the local public health department, and you should consider it in any patient who develops symptoms less than 2 weeks after returning from an endemic area or travel to a warm or subtropical region, including Florida, Arizona, and Texas, all states that have recently had dengue outbreaks. To diagnose dengue, if you're catching patients within the first 7 days of fever onset, you can send a nucleic acid amplification test. And if it's greater than 7 days, IgM testing is recommended. Again, this information is found on the CDC website. So this illustrates another point. A travel history is very important for patients and an exposure history, even when travel is within the US. Like Dr. Bente mentioned, you should ask about hiking and other recreational activities that can increase risk of tick-borne disease as well. This brings us to our last case. For this one, I want you to consider different types of transmission that are affected by changes in the environment, including food, water, soil, and dust, animals, and other carriers. So this is a 35-year-old farm worker with a history of cigarette smoking and diabetes who was admitted for pneumonia, but is not improving with antibiotics. You can see their chest x-ray on the right. What do you think this is? This is an example of valley fever, or coccidioides, which lives in soil in hot and dry regions. Cocci, as it's called, is usually found in the southwestern United States, as well as parts of Mexico, Central and South America, but the presence of this fungus was documented as far north as Washington State in 2015. Multiple factors are increasing the incidence and distribution of fungal infections. Warmer climates can allow fungi to survive at higher latitudes. Extreme weather events also play a role in the spread, such as wildfires and dust storms that can spread these soil spores. And then heavy rainfall and flooding can create environments for mold to thrive in indoor environments. The overuse of agricultural fungicides can lead to resistance, and consistently hotter temperatures throughout the world can allow fungi to adapt to living in the human body, which is previously thought to be too warm for many fungal species. This is particularly pertinent in the example of the drug-resistant fungus Candida auris that has affected immunocompromised patients in healthcare systems in the US recently. So how would you diagnose a fungal infection? It depends on the duration of symptoms. In the first month, diagnosis is generally possible by culture, PCR, or histopathology. But you should, again, suspect this in a patient who is not responding to typical antibiotic treatment and may have had an exposure. So to wrap up, these are some diseases that you should be considering in your region. Think about tick-borne diseases, mosquito-borne diseases, soil-related diseases such as fungal infections, as well as food and waterborne illness. All of these can have changes in their incidence related to not only changes in the environment, but also travel and other tree cover, other factors. Next slide. So what should you be telling your patients? Generally, we want to tell our patients that prevention is the best thing. Insects such as ticks and mosquitoes can carry disease. So we should tell them to reduce their risk by covering up, using bug spray when outside, and keeping insects out with screens and mosquito nets. Another important factor to educate patients on is that mosquitoes breed in standing water. So dump out standing water that may accumulate in old tires, flower pots, and outdoor containers. Check the CDC for advice on staying safe while traveling. And this infographic is available and was created by the World Health Organization, which has a lot more information for patients and local health departments. Takeaways. So changes in the environment lead to changes in disease transmission, as we've been discussing. You may see new and uncommon tick and mosquito-borne illnesses, as well as fungal, food, and waterborne illnesses in your area. Don't delay treatment, even if these diseases were previously unseen in your region. Know where to look for information to diagnose, treat, and report cases, i.e. your local public health department, CDC, or WHO, and educate your patients on risk reduction techniques such as wearing long clothing, tick checks, using insect repellent, and eliminating standing water. All right, that's it for my portion. We'll open it up to additional questions. Thank you so much for joining.
Thanks so much, Tara. That was really, really good. I think as a clinician, I appreciate kind of the case-based way that you presented things. And it really, I think, as we heard, Dr. Beards and Dr. Bente's presentations really put a great context for things. We are running a little short on time, and I do believe that there have been a number of great questions that have been being answered throughout. I think that in the interest of time, I think we'll go ahead and start to wrap up. For me, I think it was really interesting to hear the perspectives from the clinical side, from public health and policy side, and then from the sort of veterinary and vector-borne disease side. It really sounds like we are kind of in a very interesting moment of vector-borne disease emergence. I think as clinicians, as public health people, as folks who are trying to be ready for the next wave of whatever is to come, it seems to me that climate change is going to be something that, while we don't fully understand the role and the various ways that it's impacting the emergence of these particular pathogens, we know that it is something that we have to pay attention to, and it's something that we need to study more. And no matter what area that we're working in, this is something that we absolutely need to be taking into consideration in our scope of work. And of course, that work is in teams, as we have seen from all of the different professions that have been presenting today. So I'm going to go ahead and bring the session to a close, just in the interest of being sensitive to everybody's time. Just to close us out, I think that just to close out our bits about NETEC here, NETEC is an organization that provides technical support services. You can submit a request at netec.org or email info@netec.org. You can also submit a request online to start your technical support service request, and you can contact NETEC at any time for questions, support, and services. Great. And as I've mentioned before, NETEC services are available for health professionals, frontline and assessment facilities, and EMS agencies. NETEC is continuously developing online educational tools, technical training, and other support services that meets the needs of anyone who might encounter a special pathogen in their work. Again, you can send your questions to info@netec.org or submit a technical support service request at netec.org. So connect with NETEC by following us on social media, signing up for the e-newsletter, so you can be the first to know about upcoming trainings, webinars, and new courses for continuing education credit. You can listen to NETEC's podcast, which is called Transmission Interrupted, that is available on all major listening platforms for informative and insightful conversations with guest experts about special pathogens. You can also browse the resource library to find educational training and latest research on all stages of preparedness and response. And this brings us to a close. Again, I appreciate everybody's comments, everybody's time. Thank you so much to the panelists. I think if we were in person, we'd be having a rousing standing ovation for all three of you. We really do appreciate the time everybody took to prepare, and we appreciate all of the participants who were able to come and enjoy and learn something. Hopefully, you all learned as much as I did, and thank you very much for being here.